I never thought I would be surrounded by doctors and nurses in the obstetric and gynecology. Everything looked really exciting and scary at the same time. I have to say that we had both feelings all the time. If you imagine that lots of people shared the feeling that we felt, a bit anxious, nervous, not knowing what was out there. There was no test, there was no vaccine trial, there was no knowledge whatsoever what to do with this pandemic. We had a week pretty much to learn everything we needed to learn. And that was the intense bit, when you are in a department where you have no idea what to do, where to go, where you can get coffee and sit down. Basically nothing at all. But the good things about it is you do learn, you do see other teams working, which is very interesting to see, particularly as a dentist, that I didn't think I would be experiencing wards as much. So basically when I was redeployed, sometimes I was helping with the surgeries. So with either elective or urgent C-sections, for example, or any complication that needed to go to theatre. We were going to theatre with the doctors. It was really interesting to assist the procedures. I think that was one of my favourite bits, to actually experience that. And it's quite impressive to see how things work and how they work well as well. And sometimes I was in the gynecology wards, so we were dealing with urgencies. Most of the time, abdominal pains and bleedings and things like that. Sometimes we had to rush to A&E to see a patient that just came in, and we had to go and just assess the patient whether they should be admitted in or not to gynecology. Reviewing patients in the wards and with many different conditions, that some people needed medication, some people were just chasing some blood tests. We had to do some cannulas and some blood tests sometimes, and calling other specialties to make sure that they were coming to review the patients. And some other times we were in the maternity unit, where we were taking care of mums. And that was quite lovely too, because at the time of the pandemic, well, I think it still is a problem that family cannot come in. And it's a big problem, because moms are already under stress, worried, in pain. It's a chaotic situation where you want your loved one next to you, but it wasn't possible at the time. They were allowed during the procedure, but not pre or post procedure. So that was one of the biggest things. The midwives were amazing. They were taking care of everyone. They were really on it, and we were there just to support. They needed people there to do these little things all the time. Also, we used to review the patients with consultants, so there was this really nice learning aspect as well. Each morning, usually the round started like 7:30 in the morning. We used to go around all the patients in the wards or in the unit, discussing each case, discussing what they needed at that particular day, what we needed to chase up, what we needed to perform, if they could be discharged, if they couldn't, what was the reason, and all of that. So we were one of the specialties that went to a completely different unit. And from our point of view, we learned a lot just going and experiencing this, to have the experience and to be able to realize how I could actually transfer the skills to my setting, to my context. It really helps to understand how patients are picked up, how the A&E works, and particularly for me, that I come from a different background, from a different country, it definitely helps in a way that you put everything into a bigger context. The transferable skills were amazing to think about, that if you're in a bigger surgery, how you can translate into our small surgeries, because in our medicine we do biopsies in the oral cavity. It's a much smaller setting, it's a much smaller procedure, but you do realize how much knowledge is behind all of that, and how much you can definitely use into your daily routine. So I think in a nutshell, there's lots of pros and cons, lots of good and bad days. It was a very strange setting for me to be in. From a training perspective, that was incredible. I don't think I would gain more experience if I wasn't in any other unit during that particular time, that difficult time.